Recording in progress.
Good morning, Marcel. I think we can start because I see that we are a quorum.
Good morning, Chairperson. Good morning, members and colleagues. Yes, Chair, we are quorum. We may start.
Thank you, Marcel. Good morning, honorable members, as well as a good morning to the support staff. I just want to welcome each and everyone to this select committee meeting of social services. I think it won't be a long meeting because it's a straightforward agenda. Marcel, can you please flag the agenda?
Yes, Chairperson, I'll do so.
Honorable members, there's the agenda in front of us. Can I get a mover for adoption of the agenda?
Honorable Chairperson,
Yes, Honorable Adriansa.
I move to adopt the agenda.
Thank you very much, Honorable Adriaanse. Can I get a seconder?
Chairperson, this is Honorable Breed. I will second.
Thank you very much, Honorable Breed. The agenda is duly adopted, honorable members. So, Marcel, over to you in terms of the apologies. Is there any apologies?
Again, good morning, Chairperson. No, I haven't received any apologies. Thank you, Chair.
Thank you. So now we move over the agenda, please. So now we move over to the program of the committee. Honorable members, we already have received this program for the term in terms of our committee. Can I get a mover for the adoption of this program? Honorable Sibande.
Yes, ma'am. I move for the adoption of the program.
Thank you very much, Honorable Sibande. Is there a seconder? Honorable Baines.
Good morning, Chairperson. I will second it.
Thank you very much, Honorable Baines. So the program for this term is duly adopted by the honorable members. So now we proceed to the next agenda item. It's the consideration and adoption of the strategic plan and APP. But I will request Tabele, if you can just that report that we have received, if you can just present that one so that we as the members are on top of what we have discussed in our straight session. Please, Tabele.
Good morning, Chairperson and members. So you would have received the updated strat plan document and APP. The APP is basically what was used to populate the TEMP program that we've just adopted, and obviously what we will cover for the rest of this financial year. So I'll just take you through some of the updated information. So I'm not going to go through each page. I'll just highlight the priorities that we agreed on last week. So I'm just scrolling through it. So I'll start here on page 20. What we discussed last week in terms of the priorities for the committee for the next now going forward up to 2029, we said that under the health sector, we would focus on the national health insurance, including expenditure of the National Health Insurance Fund. We said we would prioritize health infrastructure, including inadequate medical equipment when we visit health facilities. We said we would look into the issue of human resources for health, including community health workers. We identified primary health care services as a priority, which includes district health, hospital, and emergency medical services. We said we'd also look into the medical legal cases, particularly in the provinces most affected. We also said we would look into the issue of mental health, understanding the historical information that we have with how some of the mental health issues have been handled in the past. We also said, we noted that there's an increase in lifestyle diseases, and so we said that would be one of our priority areas. We said we'd also look at public health emergencies as they arise, sexual and reproductive health initiatives, including teenage or learner pregnancy. And we said we'll try to do this work with the departments of social development and basic education because it touches on both sectors, as well as health, of course. And then we said we included the digitization of health patients' records, which includes the health patients registration system, otherwise known as the HBRS. And then, of course, we said we'd also look at nursing and emergency medical service colleges, and we'll try to do this work with either the portfolio committee or engage with the Department of Higher Education and Training. Sorry, I'm also admitting people on the side. And then under social development, which is on page 20. And then under social development, we said, we said, of course, I just forgot to mention that under health, as much as we recognize that we have 7 entities, we understand that because of our workload, it might not be possible for us to engage with all 7 entities. So we would at least prioritize 2 of those entities. And there was a proposal for looking at engaging with the South African Medical Research Council and the Council of Medical Schemes. And then under social development, we have 3 entities which we have started engaging with. And we said we'd continue that work with the SASSA, NDA, and the CDA. And of course, the priority areas that we agreed on were looking at the issue of substance abuse, especially as it affects younger people or young people. And that includes the work that is done by the CDA in terms of the National Drug Master Plan. We said we'd also engage with continue engaging with SASSA in reference to social assistance programs, as well as looking at the work that the department and the NDA is doing in relation to welfare services and poverty alleviation programs. One of the members mentioned the issue of community nutrition development centers. We said we'd also need to place close attention on the monitoring systems that the NDA has in terms of the work that it's doing, as well as the database of civil society organizations that are funded by the department or through the NDA. And then we said that one of the issues is, of course, skills, but not only in terms of training or capacity building, but also in terms of placement of social service professionals, including social workers, as well as child and youth care workers. And the issue of psychosocial services, which links to the work that the Department of Health is doing in relation to mental health, we said would also be a priority, but also looking at special needs in education with the Department of Basic Education, because it also affects the psychosocial needs of learners in schools. And then lastly, we said we'll continue the work that we've been doing, looking at the services that are provided for older persons. And then in relation to our last department, the Women, Youth, and Persons with Disabilities, which has 2 entities, we said we haven't had a chance to engage with the 2 entities. So in this financial year, we'll start engaging with the CGE, as well as the National Youth Development Agency. And we said that priority areas in relation to that sector is, of course, the gender-based violence programs, including what the department is doing in relation to that. We understand it's not an implementing department, but it plays a more coordinating role. We said we'd look at the programs on child rights, youth development programs, particularly in relation to the work that the NYDA does. And when we do go on oversight visits, we said one of the things we'd look at would be to check if our government buildings cater for persons with disabilities. Should I continue, Chair?
Yes,
Members,
you may.
the committee members would have received two detailed research documents that we sent, just focusing on the areas that the committee identified as areas that we would like to look at for our study tour. And so I'm not going to go into detail in terms of that. What we did is we basically compressed the information that we had presented at the strat plan, and we included the countries that the members suggested. And those are the ones that are listed here. The members had talked about Argentina and Brazil in South America. They also talked about China, Taiwan, and Thailand, which would be in Asia, as well as Comoros Islands, which is in East Africa, and lastly, Finland and Switzerland, which are in Europe. So we provided the detailed information for members. We did research and we provided that information as detailed in the documents that we shared with the members. And here we just tried to summarize in a matrix or in a table what is offered by the countries that the members suggested, and those areas we said we'd want to look at. So for instance, if you look at that table, you'll see that in terms of best health care systems globally, Taiwan and Switzerland out of those countries would be in the top 10. And then in terms of strong universal healthcare systems, which is in line with what South Africa is trying to do now with the national health insurance, the countries that have such systems would be China, Finland, Taiwan, Thailand, and Switzerland. And then lastly, in terms of best welfare systems or poverty alleviation interventions globally, the countries that come on top would be Brazil, China, Finland, Taiwan, Thailand, and Switzerland. But this is not to say that a country like Comoros or an island like Comoros doesn't have a good welfare system or poverty alleviation interventions as well. It also does, comparatively, if we look at countries within the continent. So that's what we've done there. And then we'll be guided by members in terms of which one or two countries, or I don't know, which countries the members would like us to start doing preparatory work for in terms of the study tour. Last week, the members mentioned that we should prioritize having the study tour in this financial year. We're already in May, so it would be good for us to have an idea where members would like us to look at, which countries they are selecting, so that the preparatory work could be done, and we could see what is feasible for this financial year, because the application process, the logistical arrangements, they take a bit of time. And then we already talked about the issue of sector workshops last week. And then in terms of the risk management area, this was discussed in detail last week, but what we've added is that one of the ways to address the issue of overlaps between NA and NCOP committee oversight is through 3 years planning. I think this was suggested by the deputy chairperson of the NCOP. And then in terms of ensuring that there's adequate monitoring of process legislation, as well as our recommendations, what we've added is that it would be useful for us as a committee to discuss the findings of our oversight visits with not only the provincial departments that we visit, or the provinces that we visit, but also with the national departments, as well as liaise with our internal ICT system to see if we can develop an electronic data repository system that we can use and members can access by a click of a finger and be able to see out of the recommendations that we've made, how the department is responding to those or has responded to those. So this is something that we still need to liaise with ICT and see how far we go with that. We already spoke about the upcoming legislation, the main one being, of course, the South African Tobacco Products and Electronic Delivery Systems Control Bill that is currently with the Portfolio Committee on Health. And then lastly, we have our annual performance plan. Like I said, for this financial year, Marcel has already presented what we are doing this term, and that is populated here, May to July, that column there, what we're doing. And then for the rest of the year, we said, of course, the legislation will be dependent on when the legislation is referred to us. And then in terms of oversight, we already mentioned that in the next term will be a shorter term based on the framework that was presented last week at the strat plan. So basically, it involves I think it will be a 3-week period, which has an oversight week. And we've already established that we would like to go to the Eastern Cape for that, and that will be in September. And of course, there might be a provincial week. I'm not sure at this stage, but there might be a local government week. But if the program changes, we will then include these briefings as well. And then, of course, in the October to December period, we will deal with the annual report briefings. And there is an oversight week again. So the committee will decide which province that we would like to go to and possibly do a joint oversight trip with our counterparts in the Select Committee of Education. And then the last quarter there, we'll be dealing with APPs of departments in the March-April period before the financial year ends. And that's also the period where we receive the State of the Nation address, the budget speech, and then possibly have briefings with provincial health departments on health infrastructure development. And in terms of public participation, that basically links with the work that is done through the NCOP programs, like the ones that I've just mentioned, but also the briefing, the joint briefing we are going to have with the Select Committee on Education, where the CGE, the Commission on Gender Equality, will present their research on learner pregnancy. I think that is scheduled for this term. It was read out as part of the term program earlier. And of course, they'll be taking Parliament to the people as well in November of this year, if the program doesn't change. And then in terms of international participation, it's of course the joint study door for this financial year. I've provisionally just put it there for the end of the calendar year. But then obviously this is dependent, as mentioned earlier, on various factors, including where the members would like to go and how soon the application process is processed and approved. And yes, and the availability of the stakeholders we would like to engage with on that particular country. So Chair, that's basically it in terms of our strategic plan for 24 to 29 and our APP for this current financial year. Thank you.
Thank you, Tabile. Honorable members, the presentation was made on our APP. Is there any questions or clarity in terms of the APP and straight plan, updated straight plan? Honorable members, Honorable Aris, then Honorable Makwele, and then Honorable Adriansa. Honorable Aris, you can proceed.
Yes, thank you very much, Chairperson. And I think thank you very much for the presentation. I think it was well captured. That is exactly what we have been discussed or have give input on. I think, however, that the proposed study tours, I think we need to speak about that, because I actually want to see, when did go through the presentation, I think that my proposal will be that one of Brazil and Switzerland, because we will see, it's not only, we will see a lot of departments, or we will cover a lot of departments within that countries, and how they are successfully doing their social projects. So that's the only input that I want to give on this strat plan. And then, yes, this one, it slipped my mind now, but it's fine. No. Can I come back maybe later, Chairperson?
Yes, Honorable Aris, but your language, which please.
Thank you.
Honorable Makwele, over to you.
No, thanks very much, Chairperson, and greetings to you, honorable members, officials. Let me join Honorable Aris that what the department presented, that is what we have agreed upon in our strategic plan. I therefore move that we adopt, but maybe, Chair, also to agree with Honorable Aris to say, when we were choosing the country, we made priority China and Switzerland, which I also agree with her. But other than that, we also made a requisition to say, we are as the select committee, our wish is that we need to undertake that the same study tour, at least now at the beginning, while we are still starting our term. Because if we can start taking the study tour very late, it will be a problem to us, because remember, we are a country. We need to when we do what we call benchmarking. We need to benchmark with countries so that we can improve the level of health in our country. So I should think the sooner the officials try to move with the speed, the better. But other than that, is the true reflection, Chairperson. Thank you.
Thank you, Honorable Makwele. Honorable Adriansa.
Thank you, Honorable Chairperson. It looks great. And all I want to ask is, although I wasn't part of the strategic planning session, I just want to know if you will correlate the plan of benchmarking with the other committees, such as the joint standing committees, the JCI, so that we don't have double ups. Because I believe we need to just make sure that when we do this, we don't miss out because we're busy with something else, that we can fit in everything everywhere, if possible. Thank you.
Thank you, Honorable Adriaanse. Honorable Chirwa.
Thank you, Chairperson. I know these are last minute additions, but I think they're important, particularly on obstetric violence in the health sector. Apologies, I'm traveling, and then on the point on the MRC and increasing research capacity, I'm just checking if maybe I might have missed it on the autism spectrum aspect. That we add that as a priority in regards to research. And lastly, I think departments must give us reports or an overview on facilities that are no longer functional, like that have closed down, whether it's a hospital, whether it's a place of safety for women, so whatever falls within their scope, I think the committee needs to know which facilities are no longer functional or have been closed down and the reasons behind that. I think that's going to assist with our oversight function. Thank you for the opportunity, Chairperson.
Thank you, Honorable Chirwa. Back to you, Honorable Aris. Honorable Aris. I don't know where is Honorable Aris. Tabile, back to you.
Thank you, Chairperson and members. So basically, we're integrating the contributions from Ms. Chirwa. And then just to answer Ms. Adriance's question, yes, when we are making the arrangements, we check with members' availability so as to avoid overlaps as well as and trying to ensure that everyone is accommodated. And then with regards to the study tour, Chairperson, the countries that the members have mentioned are 3 now. So now we have China, Brazil, and Switzerland. So I'm posing that one back to you, Chairperson, and the members. Are those the 3 countries that the members are identifying for the study tour? Thanks.
Thank you, Tabile. I think that is 3 countries. So I think we as the committee must discuss this because the other select committees has also identified some of the countries. So maybe if we can integrate it with the other select committee that we are part of and see that this side of the select committee on social services only identifying 2 countries, and at the other side of the select committee of education, we can then put one of the countries in that study tour. Honorable members, any suggestions in terms of that? Honorable Du Plessis.
Thank you, Chair. Apologies, I just had a slight technical issue. I'm not fully, there was only one member. Basically, I agree with you, and I think we do need to have a real discussion on this because I think we're all sort of driving various agendas, but I think if we have a meeting just talking about what exactly needs to be done between the two committees so that we can optimize the various trips. So I do support your suggestion.
Thank you very much, Honorable Du Plessis. So, like I have said, indicated, it's now 3 countries. We as the committee must interact with each other so that we can have maybe Brazil and Switzerland from our side. Because according to me, that is the welfare system, because Brazil is also having a good welfare system, and then Switzerland. And then we can include China in the study tour of the education sector. Honorable Makwele, is it fine with you?
Chairperson, I fully and I seconded your proposal. I fully agree with you on that one.
Okay, thank you very much, Honorable Aris. Then we are done with that in terms of the study tour. So it will be Brazil and Switzerland. Then we can now move over, honorable members, to the minutes. Marcel, you can flag the minutes. Honorable members, we have received the minutes. Is there any corrections on the minutes? If none, can I get a mover for the adoption of the minutes? Honorable Du Plessis.
Chair, I move for the adoption of the minutes.
Thank you, Honorable Du Plessis.
Chair, I'll second the minutes.
Honorable Aris, thank you very much, Honorable Aris. I think that is the last item on the agenda, Marcel.
Yes, Chairperson, that is.
Thank you very much, honorable members. I really appreciate your time and effort that you put in to be part of this meeting. So do enjoy the rest of your day. The meeting stands adjourned.
Thank you, Chairperson.
Thank you, Chairperson.
Bye-bye.
Thank you very much.